Well, mesenteric anatomy is basically the blood vessels that go to the gastrointestinal tract travel through a structure called the mesentery. And the anatomy of the mesentery has been inaccurately described over the last 100 years. And that's been perpetuated and indoctrinated in all anatomic, embryologic, and surgical and radiologic texts. In the last 3 years, we've managed to actually show that's entirely simpler than what was previously thought, and we've managed to refute what was inaccurate and entirely change the manner in which we're thinking about the mesentery and the structures that are around it. So that has an impact then, obviously, for surgery, for the safe management of patients, for the training of individuals who are going to conduct surgery. It has a massive impact in terms of radiologists and how radiologists will actually perceive the abdomen on CAT scans, MRI scans, etc. It has an impact from a pathology perspective insofar as we can now better stage all abdominal diseases because we have a better understanding of the structure of the organs involved. And it also has an impact on oncologists who can then treat patients with cancer, for example, because they've been better staged because we now have an improved understanding of the structure. This will vastly improve the experience for the patient in the first instance. We frequently conduct laparoscopic surgery now based on the anatomic principles that we've developed with absolute minimal amounts of blood loss. And that's fantastic in an area that was previously noted for blood loss. And again, in UL and UHL, we've developed approaches where we can minimize blood loss down to less than 50 mils in major abdominal surgery. That helps the patient enormously. The patients recover a lot quicker, a lot faster. They can be discharged faster. They recover daily function faster. They get back to work faster. And overall, that experience is improved. From a training perspective, we've made colorectal surgery safer because as a result of this clarified, simplified appreciation of the anatomy of the abdomen and the gastrointestinal tract, trainees can now conduct colorectal surgery, can learn how to do it a lot quicker and a lot better, and are a lot more efficient and safe as a result. So it has had impact at numerous levels, from training to service delivery, and also to the treatment of patients individually. Well, we've combined multiple different investigatory tools. And using multiple different investigatory tools, we've identified the actual shape of this particular structure. And by providing a clarification of shape and structure, you can then differentiate it from abnormality, i.e. disease. And a better understanding of shape of disease then permits you actually identify what's abnormal in disease and mechanisms of disease. So a perfect example of that would be Crohn's disease. And because we now have a better, improved understanding of the gastrointestinal tract anatomy, we have, as a result, a better understanding of how the associated mesentery affects the bowel in an abnormal manner. And we've been able to make inroads and again developing biomarkers of outcomes for patients with Crohn's disease based on these subtle differences.